upper right shows after a keratectomy shows the radiation. Always bothered by this picture because I'm also irradiating my fingers, aren't I? And then the picture on the lower right is after everything's all healed up. Looks a lot better. Here's a lid, eyelids, nasal part of the upper lid and medial canthus is affected by tumor, and you see we lasered it with a CO2 laser in the lower right picture. There are other options: immunotherapy, chemotherapy with intralesional cisplatin 5-FU. These are better described in other places, but I mean there are options here to people that don't want to do surgery, can't do surgery, or the lesion's too not amenable. The picture on the left is pre-treatment, and the picture on the right is after cisplatin. Looks like it shrank it down, but I'd be still worried about this one as to whether that's granulation tissue or the tumor. Various options. I've used a lot of topical. For uracil, you use the intravenous intravenous form. There are dermatologic ointments of 5-FU available. For topical mitomycin, piroxicam systemically helps a small percentage of horses because of its effects on the COX-2 site. There's a real large, but some of these just, cancer's bad. I mean, everybody that's listening knows that, and I don't have the magic answer for this, except the earlier it is, the better. This is in the lower lid, and it was so much involved in enucleated it. See, we're trying to remove it, and it's just too much, and months later, it just takes over the whole face, and has to be euthanized. There's a new therapy for squamous cells called photodynamic therapy, where you inject a dye, inject it into the lesion, into the tumor, and then use a special red laser to incite the dye to become active and cause tissue necrosis of the tumor. It has some really good potential if you have the laser, I guess. And I mean, here's an example on the left of injecting the dye into the lesion, and then here's on the picture on the right is the laser. Just a lot of times this can be done standing, but once again, the sooner the better. Sarcoids, just a few pictures of sarcoids. Several different forms, some more responsive to therapy than others, some more aggressive than others, maybe viral, at least in some. Some breeds like leprosoners appear to be resistant. This one, the picture shows a really large lump, non-ulcerated skin dorsally. You can read this too. A lot of different therapies. BCG is probably most reasonable, and the sarcoid experts, and there are some actually. There are some veterinarians who specialize in sarcoids, and they always use BCG first before anything else fails. And there's caustic substances, and there's a lot of anecdotes about particular substances making a difference in these, and I'm sure they do. In my mind, the best thing is radiation, and I don't have that option anymore. I mean, here's another type of sarcoid, two pictures of it in the same horse. Different sarcoid. This one's on the side of the lid. The red arrow shows it, the mass.